Minimum training dose for hypertrophy. What's the least you need to do in order to make muscle gains in size? In order to get yoked and jacked, which is what everybody deep inside them, phrasing, really wants. In the world of lifting, we have the HIIT crew, the high intensity training sort of people that claim that 1 set per week or just a couple of sets per week to failure, but like to absolute failure, where you're there literally fighting with the weight and you can't move it anymore, is more than enough for you to maximize your hypertrophy gains. But unfortunately, for all of us, that is not true. The research has consistently shown that more sets will lead to more gains. So doing 10 to 20 sets per muscle group per week will allow you to make more, substantially more gains than doing, let's say, 1 to 4 sets per week. But do not think that 1 to 4 sets per muscle group per week will get you 0 gains. They will still probably get you around 65% of your potential gains. And if you do a bit more than that, so 5 to 9 sets per muscle group per week, you're gonna be looking at like roughly 80% of your potential gains. So sure, if you're somebody who wants to get as jacked as possible, and I'll get to why the minimum effective dose concept applies to those people as well. But if you're somebody who has all the time in the world and no stress whatsoever, and they just want to get as jacked as possible, look no further than 10 plus sets per muscle group per week, 10 direct sets per muscle group per week. So that wouldn't mean 10 sets of biceps where you're counting back exercises as bicep exercises. That would mean 10 plus sets specifically of isolation bicep work done per week. But if you're somebody who wants to get jacked, but also has other things going on in their lives and is often faced with periods of time where it's not really possible to get all that volume in, maybe because there's no time, maybe because you can't recover enough, or maybe because you're not feeling like it, doing 5 to 9 sets per muscle group per week, which is not a lot of training, and taking those sets to failure, very close to failure, which is something that the literature has shown us to be very important for hypertrophy, will be more than enough to still get really, really solid gains. And I'm talking about the majority of your gains. You can't, if it was more than the majority, then it would be all your gains, and that doesn't make sense. But you can still get almost all of your potential gains with just a few sets. Now, to take it a step further, if you even do as little as a couple of sets per muscle group per week, so that would mean me going to the gym on Monday, doing 2 sets of push-ups to failure for my chest, 2 sets of tricep extensions for my triceps, 2 sets of bicep curls for my biceps, 2 sets of lateral raises for my delts, and maybe, what am I forgetting? A couple of sets for my lats and for my upper back. I could literally do that for the whole week, and for those body parts mentioned, I'd still be looking at making roughly 60% of my potential hypertrophy gains. We're talking about very, very low amount of training in order to still get a meaningful, at least for everyone, response. Side note, if you're somebody who has been trying to really optimize things and you've been doing a bunch of volume, but you may be thinking that you're not training hard enough, going down to roughly 5 to 10 sets per muscle group per week and taking those sets to failure, so to momentary failure, to the point where you can't get any more reps despite attempting to do so, you may be surprised to see that those sets are more effective than just doing more volume for the sake of doing more volume. Keep that in mind, and it is worth experimenting with less training volume for some periods of time, seeing how that feels. When it comes to muscle growth is a process that takes a long time. So you doing less than optimal for a few weeks here and there is not really going to be very detrimental to your long-term progress, even if absolutely maximizing muscle gain is your goal. And it sure as hell will be much better than doing absolutely nothing or skipping sessions or feeling like you're not really doing well and noceboing yourself that you are leaving gains on the table because you can't get your full session in. So a few sets per week performed with intent, with intensity, can lead to absolutely great gains, although suboptimal, and allow you to still make those damn gains even when things are not looking that great as far as time availability or recovery resources go. Anecdotally speaking, we even have a lot of natural, just kidding, just kidding, just kidding, just kidding. I'm not gonna continue adding layers to the meta joke here, but we have a lot of natural and enhanced lifters training and preaching that lower training volumes are the best thing ever, and you don't need to do so much training volume as some other people, or even the research says that you have to do. So you have those anecdotes in conjunction, obviously, with the research to essentially show you that you're probably going to be just fine training with lower volumes, especially for relatively short periods of time, like a couple of months here and there. Keep in mind to select exercises that bias long muscle lengths, control the eccentric, get a nice stretch, take those sets to absolute failure. When you think you're at failure, try for another rep. When you can't physically move the bar or the machine anymore, call it a set, have your protein, go to sleep, enjoy your gains. minimumdosetraining.com for free templates if you want to check them out. There's no sales pitch here, it's literally free templates, and minimumdose.training for some of the literature on making gains using a minimum effective dose training concept. If you have any questions, imagine Tom Platz sitting there looking at you in the eye, screaming 5 more.
One more for 20. Come on.
Get those 5 more reps, get another 5 after that, faint, wake up, get another 5 reps, go to the hospital, get diagnosed with rhabdo, tell the doctor, nice try doctor, last time I checked, academics were the real doctors, get a real job nerd, slap him, slap the police when they come to arrest you, get your ass to the gym, ignore rhabdo, finish your set, get those extra 5 reps, and enjoy your hypertrophy gains with just a few sets per muscle group per week. Peace.